The biggest challenges are the vendors because the vendors, as I mentioned before, have been driving this industry. If you look at where we were exactly 10 years ago, hospitals were very much automated throughout all core environments like ADT, laboratory, radiology, pharmacy. These markets were saturated already, and all of a sudden there was this big vendor hype that everybody called the Y2K crisis that very much in 1999 alarmed in every company and every organization in any industry, but in healthcare, basically it forced hospitals to stop looking now at the clinical automation and go back to those areas that were already saturated. So if you look at what happened over the last 10 years, hospitals had to reinstall all the core components and got to the point where they're looking at clinical data exactly 10 years later. And at that point, they're realizing again that their big HIS partners are not covering those areas very well, and that now they're forced to look at best-of-breed technologies and emerging technologies. So the biggest challenge is the vendors, and I think that hospitals, they have to start forming organizations of hospitals that are using similar systems so they can leverage from their strength to be able to force vendors to open up and integrate with other technologies. Of course, this cannot be done without the assistance of the federal government, because the federal government has to establish the standards for interoperability, but also they need to enforce that vendors support interoperability between their systems and with other systems. And of course, that is the direction that the government is taking with the certification that is required in order to qualify for the reimbursement of meaningful use.